Are you feeling less than your best, but being told you're fine because you're just simply not sick enough? There's a big difference between surviving and thriving. And in this episode, I'm joined by Dr. David Hellman, who is the medical director at BeautyDot here in Wichita, Kansas, to talk about what it means to go beyond traditional medicine and into the world of health optimization. We're going to cover the shift from managing illness to building resilience, hormone optimization and how it impacts your energy, clarity, and performance, the 4 pillars of lifestyle medicine: nutrition, movement, stress, and sleep, and then a bunch of powerful emerging tools like peptides, ozone therapy, PEMF, and molecular hydrogen. This episode is for anyone who's ready to take their health seriously, not just avoid disease, but to optimize life. Welcome, Dr. Hellman, to the podcast of Heal Without Harm.
Yeah, thank you. You know, what you said was kind of interesting. There is a big difference between thriving and just surviving.
Mm-hmm.
And I was trained in allopathic medicine and practiced emergency medicine for many years, and then started to see my health kind of go down that less than thriving stairway, less than thriving path. And so I decided to do something about it. I gained 35 pounds, brain fog, lack of energy, lack of libido, poor focus, a lot of things that some of my patients come to see me for.
What age was this? Just to give us an idea.
This was I was thinking it was in my mid-40s.
Okay.
And I decided, I'm going to do what we've been taught in allopathic medicine for the last 60 years. Hadn't really helped, but, maybe you've never heard this, but eat less and exercise more.
Yeah.
A new concept.
Simple and easy, right?
Yeah. And so for a whole year, I devoted myself to being very physical. I was always kind of physical, but I devoted myself to going to the gym. I mean, religiously for 6 days out of the week, went to the gym. I'd work a 12-hour ER shift. I'd be there that night. If I worked that night, I'd be there that day. After a couple of months, it became habit. But I after a year, I got stronger, but I didn't see the results I kind of expected. So then I thought, okay, 80% is diet. So I'm going to do diet. So I did 4 months of paleo, 4 months of keto. I tried low carb, high protein. I was even vegan for a couple of days a week. I had a friend say, hey, you need to just eat fruits and vegetables a couple of days a week. So after 2 years of doing that, I didn't see the results I wanted. So I thought there's got to be something else. So I heard about this clinic. It was one of the first anti-aging clinics, and I went to one of their conferences. And it was really interesting. I'm at this conference, and they're talking about subjects you normally don't hear at a medical conference. Things like sleep and stress and nutrition and supplements and exercise and movement. Some of the things you just mentioned. And I thought, this is really different. And I started looking around at people in this conference who were maybe 20 years older than me, better shaped, better fit, and asking very pointed questions. So I thought maybe there's something to this. So I became a patient. 18 months later, it changed my life. I decided I'm going to learn this kind of medicine. So I went through their fellowship program, and it was a program that really taught, hormone optimization, lifestyle changes. And I came very close to being a franchise physician. And then I met the owner of BeautyDot just by chance, just out of the blue, just by chance. We were at a fundraiser. I met her. And she said, you need to go to A4M. It stands for American College of Anti-Aging Medicine. So I thought, man, before I become a franchise physician, I'll check it out. And I went to their conference. It was a couple months later. And I was really blown away by the quality of the science, the speakers, the education workshops, the expanse of it. It's been around 30 years. People come from all over the world to train there. So I said, I'm going to learn this kind of medicine. And it's more or less functional medicine. And after 2 years of doing that, I just saw a light bulb went off. I said, why aren't we all doing this? I mean, the tenets of functional medicine are, let's get to the root cause of problems instead of just treating the symptoms. Instead of putting Band-Aids on bullet holes, let's really find out what the root cause is. Let's take a biological systems approach, because the body doesn't work isolated.
Mm-hmm.
In allopathic medicine, we tend to isolate things. You have your heart doctor, you have your lung doctor, your kidney doctor. We tend to isolate things, and they all tend to work together. So it's really kind of a systems approach. And it really taught me just a different a different paradigm, a different mindset, just a different approach to what it takes to be healthy. When we're taught in medical school, we're taught about diseases. We're taught about how to diagnose a disease, how to treat a disease. What's the latest pill or procedure? In functional medicine, we're taught differently. We're taught what's causing this disease and what we can do about it. And a lot of it has to do with lifestyle. The major diseases that we see that are killing people, cancer and cardiovascular disease, a lot of that's lifestyle driven. So we're talking about lifestyle. We're taught about supplements. We're taught about movement and exercise. We're taught about detoxification, sleep and stress. Those are things you just don't naturally get taught about in medical school. So it really opened my eyes to just a different approach. And once you go down that rabbit hole, then a whole nother world opens up. Like you said, some of the things you mentioned, that is energy medicine, and we're not taught anything about energy medicine. And if you look around the world, that is a big part of their health optimization programs. And so being healthy is more than just an absence of disease. It's actually being able to thrive, being able to do the things you want with clarity of mind, with focus, with energy, with vitality. That's kind of how I approach it. And so it's not what I do. It's kind of who I am. It's really kind of a fascinating aspect of medicine because it's growing so fast. There's a lot of money and a lot of research going into it. Jeff Bezos of Amazon has devoted a bunch of money to it. Google is looking into it. So longevity medicine, the kind of medicine I practice, longevity anti-aging medicine, along with BeautyDot, which is a medical spa, is really a fascinating kind of medicine because it's just growing. And a lot of it, give or take what you think about the internet, but I think it's patient driven because people are getting on the internet and finding these different modalities, these different therapies. A lot of people are frustrated with allopathic medicine. And I have a lot of people come to me and say, hey, I've seen 3 or 4 different doctors and they can't figure out what's going on. And so it's also a great challenge. I get to play medical detective.
Yeah, I know. And that's what, to me, keeps it so interesting because as a physical therapist, I feel like you and I are similar, just if in different genres of the medicine. And like you said, people go to multiple doctors. And I even had a patient yesterday talk to me about some irritation that he had kind of on the side of his head. And I said, this may be muscular, but it doesn't really sound like it. How long have you had it? He said 6 weeks. And I said, okay, so it's been a little bit of time. I said, if you don't see like resolution based off what we do today, like I think I should refer you to your regular doctor, but I'm sure they're probably going to kind of dismiss you, right? And be like, oh, you're fine. Or send you to an ENT. And he's like, yeah, and then I'll pay a bunch of money and still not get answers. And I think that's just what the general public expects is a lack of answers or a prescription. So in my observation, a lot of people that I talk to around my age, 30 or so, they end up just not going to the doctor. It's well, I don't want to do what I think they're going to give me. So then they just do nothing, which I know sometimes can progress disease or progress, whatever they've got going on because of lack of treatment. And so I appreciate you saying like, hey, let's get down to the root cause. And then one of the first things that jumped up to me when we spoke was you talking about what we call the 4 pillars, but ultimately, sleep, stress, hydration, and nutrition, just taking care of the basics. There was something you said a couple times, though. I don't think I've heard this word. What is allopathic medicine?
Allopathic is the traditional medicine.
Okay, gotcha.
That's traditional medicine. That's traditional training. That's medical schools as we know it. That's MDs, DOs as we know it.
Okay, gotcha. Okay. And with those, you said, you also mentioned what you didn't get in school, how you weren't trained. And I think there's a big assumption that medical doctors do get nutrition training. They do get training about what a healthy lifestyle is. And it seems like that's lacking. That's not there. It's more when someone comes in with these problems, here's what you give them or do to make them somewhat go back to baseline, but then they're on like lifetime medications to do that, as opposed to, like you said, being a detective and saying, why are you showing up with high blood pressure? Why are you showing up with obesity or diabetes or pre-diabetes? And I think that's, in my perspective, the difference between allopathic and where you are now. Am I outlining that well?
No, it's perfect. I see a lot of patients that come to me and say, hey, I go to my physician And did you know that the average visit to a family practice or a first line provider is about 7 minutes? And that's just not enough time to kind of find out what's going on with the patient. It's enough time to hear their symptoms and write a prescription.
Mhm.
It's just not enough time to really delve into it. And one of the things I find is fascinating is when you listen to the patient, a lot of times they will tell you what's going on. And when you say, we're not taught nutrition, I don't even remember hearing the word nutrition ever spoken in medicine. Now, one of the interesting things I found when I first started doing this medicine, I was taught by a really brilliant guy. He was a head of the University of Cincinnati's pharmacology department. And he would take his students and say, here's a list of medications. He says, okay, what nutrients do these medications deplete? And we're never taught that, So, you list down magnesium, chromium, zinc, CoQ10, different elements, B vitamins. And then you say, okay, what are the symptoms of these elements? What are the symptoms of these nutritional elements that are deficient in your body? And then what are the side effects of medicine? And they would match. And a light bulb went off in my head and said, why aren't we taught this? So we're not taught about stress, sleep. We're not taught about hormone optimization, lifestyle medicine. I like to think that the kind of practice that I have, and it's called functional medicine because we get to the root problems and just what we talked about, but also integrative medicine in which we integrate different modalities, different non-traditional modalities to treat things. Like you said, PEMFs and ozone therapy. We do IV nutrition. So it's really trying to find all these different. I just have kind of a natural curiosity, and it's led me down this path to trying to find different modalities and therapies to help the patient, not just a pill or procedure.
Yeah.
And when you incorporate lifestyle, you have to start at the foundation. Like you do, you have to start at 4 pillars. When you incorporate those 4 pillars and then you optimize those, then you can really get the patient in a place where they're more open to other things to help them even get more optimized, to even get more healthy, if you can say that. But it's all also about prevention and trying to prevent a lot of diseases. I get a lot of patients come to me and say, I don't want to go down the path of my parents.
Yeah.
I saw my parents. I saw what happened to them. They end up in a nursing home or assistance. And I saw what happened to them the last few years of their lives. They were on 7, 8, 9, 10 different medications, and they really weren't optimized. They really weren't functional. They didn't have good quality of life. I don't want to do that.
And they'll drag that out sometimes for 10, 15 years.
Yeah.
You know what I mean? Like we're as a medical society, really good at dragging out death in a way, right? Where it's like very poor life, but they're like people can be there, highly medicated for 5, 10, 15 years. And that just sounds horrible.
Yeah. It's just managing the disease. When I started emergency medicine, I'm board certified in emergency medicine also. When I started years ago, it was very unusual to see somebody come in with 5 medications. And then when I finished 2 years ago, I did my last ER shift on Christmas. Yeah. And I started this full time, but it's not unusual to have patients come in with 11 or 12 different kinds of prescriptions. And to see that evolution of where medicine is going, it's kind of disappointing that we don't really look at the systems approach. What are these different medications, how they work together? What do they do? How they mix in a body? You just don't know. I remember rounding in the hospital when I was in medical school, and we rounded with the head of the pharmacy department. And he was a young guy. This was years ago. He was a young guy. And he said, when a patient's on about 4 medications, that 5th one, you don't know what's going to happen.
Nobody does research on what is it like
when
they're on 5 meds.
Yeah.
No.
Tell me the research of a patient on 3 different medications. There's nothing like that. So we really don't know. And it's kind of disappointing. So I try also to get patients off medications. And it's when you look at the 4 pillars, when you do the foundation, when you do the nutrition and the lifestyle, and you manage the stress, which is so important. Everybody's stressed out these days. When you manage that stress, you get people to sleep, get people to eat right, then it's pretty amazing. You see these transformations, and you can get people off medications.
Which is honestly life-changing from like so many different perspectives. And some things that you alluded to a little bit ago is, and I think you and I operate pretty similar, is when someone comes in, it's like, let's go find everything that's wrong so we know exactly how to address it, as opposed to like, oh, you're saying these symptoms, here's just a pill for it. Let's like, why is this low, or why are you feeling this? Why is the symptom here? And so when I spoke to you ahead of time, we talked about doing blood labs. And you told me, and I think I spoke with on our last podcast about this, but we talked about the labs that you would do versus the labs traditional medicine would do, and how those potentially differ, and then how you would read those results, even if it was the same lab, normal versus optimal. And so can you talk a little bit about what are like, why normal labs may not mean you're actually truly optimally healthy? And then what labs do you run with people traditionally versus allopathic medicine?
It's funny you mention that. I had a patient come in the other day and say, here's my labs that I received for my annual physical.
Mm-hmm.
And I looked at it, and it's the same labs we've been doing since the 1960s. Okay. We have a lot more information now, a lot more knowledge now on what labs really have some meaning. So yeah, I do different labs. And just to give an example of optimal, a common lab that we do in traditional medicine is called TSH, thyroid stimulating hormone. It's to look at your thyroid. You get it in your annual physical. You know, your patient's you walk into your family doctor and they're going to run a TSH. The reference range on TSH, just to give an example, is like 0.5 to 4.5. That's normal. Okay. Optimal is actually 2 or less. And so you can be at 3.5, you can be at 4 and consider it optimal. And normal, and you're far from optimal. Another example is like blood sugar fasting glucose. It's 70 to 100 is considered normal. There was a large insurance company out of California back in the late 90s who said, we're seeing a lot of diabetics. We're seeing a lot more diabetics. We're spending more money on office visits, medications, surgeries, dialysis. Is there any blood marker out there that we could look at that would tell us who's going to become diabetic so we can have an intervention? And they looked at 50,000 people over about 12 years. And what they found was fasting glucose was a very good marker. 84 or less was optimal. Every point above 84 gave you an extra 6% chance of becoming diabetic in the next 5 to 7 years. So you can be normal at that reference range of 70 to 100. You can be normal at 99, and you'll have a 90% chance of becoming diabetic in the next 5 or 6 years. So that's where you can take that and have an intervention, so to speak, and prevent that person from becoming diabetic instead of waiting and then put them on medication for diabetes. Let's do something about that. Let's look at your diet. Let's look at your lifestyle. Let's look at what you eat, how you eat. Let's look at your sleep. Let's look at your stress. How can we optimize this so we can prevent a lot of disease?
Because the writing's been on the wall potentially for years, right?
Yeah.
I had one patient who was complaining, he had kidney stuff and things like this, and he was mad because like he was going to his doctor, getting all this stuff. Then he came down with diabetes or something like that. And he went back and he looked at all of his labs because he started doing research himself. Just like you said, people get on the internet and information is very widely available. And he was like, I've been pre-diabetic for the last 5 years. My doctor never said a thing. And he was pissed, and I would be too, right? It's like, what are we doing here? And it's right there to where if all he said was like, hey, your blood sugar is starting to move up, like let's start looking at your diet. He may not have ever had any of these secondary, tertiary diseases or like body symptoms if it was just addressed earlier, ultimately. So what labs, do you run the same labs as traditional medicine, or what does this look like?
I look at a lot of different things. I'll look at inflammation, because inflammation, about 20 years ago, a lot of researchers started looking at patients with chronic diseases. You're talking about hypertension, diabetes, cardiovascular disease, cancer, autoimmune disease. And there was always this underlying inflammation that they didn't see in regular control groups. And they asked themselves, if we address this inflammation, would it have an effect on this disease process? Sure enough, it did. So in medicine, we thought we found the holy grail. All we got to do is fix inflammation and everything goes away. Mm-hmm. It's not quite that simple, but it's really important. So I look at markers for inflammation. I'll look at markers for methylation. Methylation is so important, especially in women. A lot of what I do is hormone optimization. And with women, after menopause or perimenopause, they need estrogen, they need progesterone to have good quality of life. But women will metabolize estrogen down 3 pathways. I call it the good, bad, and ugly. I wish I'd have came up with that, but I liked it. Okay. So the 3 pathways is you'll metabolize estrogen down to hydroxyestrogen, and that gets excreted. That's a good pathway. That's actually preventative of breast, ovarian, cervical, and uterine cancer.
Okay.
The other pathway is 16-hydroxyestrogen, and that's been implicated in breast cancer. And the third is 4-hydroxy, and it's implicated in all 4 of those cancers. And so what I look at is their methylation process, because the body will methylate those 2, that 16, that 4, and neutralize them. But 40 to 50% of North Americans have a genetic mutation called an MTHFR mutation. I have it, in which they don't methylate very well. And so you put yourself at risk for those cancers because you don't methylate very well. So if I'm going to put somebody on hormones, if I'm going to put somebody on estrogen, I want to know what their methylation status is, because the cure for that is just extra B vitamins and activated folic acid.
Interesting.
Yeah. And so I look at that. I look at a full thyroid panel, not just the TSH. I'm looking at your panels for stress. I'm looking at a full hormone panel. I'm looking at some minerals that are, we don't pay enough attention to nutrition and medicine, and specifically minerals in medicine. So I'm looking at different minerals and vitamins that really have an impact on your health.
Mm-hmm.
And they're foundational. Foundational B vitamins, zinc, magnesium, potassium. Those are the kind of things that you need to look at to optimize somebody's health. And you can have an intervention. I mean, it's easy to just, change your diet.
Mm-hmm. For sure. So for people listening right now, we're talking about a lot of stuff that I think would hit and resonate with them. But what are some of the more common symptoms that people will come in with that you'll notice a pretty quick correlation with something off in their vitamins, or something that may even correlate to just a simple change, like, hey, eat an apple every day, just something like basic? What are some of those common threads that you'll notice as a trend among people?
I get a lot of people coming in, and like myself, fatigue. Just fatigue. And you said it before, it can be foundational hydration.
Mm-hmm.
A lot of people come in are dehydrated. We come into the world as a grape, but we leave as a raisin. You want to be a grape as long as you can. Okay. Yeah. So I tell people, no, just get hydrated. Fatigue, brain fog is another one. A lot of brain fog. I do a lot of things to optimize people's health that are just pretty basic,
mm-hmm.
but also there are some. So it's just like I said, it's just a different approach. You have to recognize that. And I use artificial intelligence to help me with that. I use a program that really helps to look at your symptoms. It combines your symptoms with your labs. We know that symptoms can occur decades before you can see it in your labs. You can have symptoms in your 30s and 40s, and we won't see it until your 50s and 60s. That's why I get a lot of patients coming in and say, gosh, I have brain fog. I have lack of energy. I have poor libido. I have, body aches and pains. And they'll say, well, my labs are good. And it's because these symptoms occur before you can see it in your labs. And what this artificial intelligence does is combine your symptoms with your labs to really help me to kind of focus and pinpoint on the issues that are personal to you. I like to think my practice is a functional, integrative, personal precision medicine. Now, I know that's a lot to say, but it's really just kind of a different mindset in which you treat the individual, you treat the person, and you can see a lot of these symptoms are related to what's going on in their lives. What are they eating? What are they well hydrated? So when you say what are some symptoms that people have that come to see me, it's a whole variety of symptoms, and it can be just a lack of nutrients, just a lack of hydration, just poor sleep. Everybody's stressed. 24/7. Everybody's stressed, and people realize that that stress, there's different kinds of stress. Most people know that there's emotional stress and mental stress. Emotional stress, I kind of fight with my spouse or my principal or my kids or whatever. And mental stress can be, how am I going to make this car payment? How am I going to put food on the table? How am I going to send the kids to college? There's other stressors. There's nutrient depletions. There's imbalance in hormones. There's infections. There's traumas. There's poor blood sugar control. These are all stressors. Infections, a big one. These are all stressors on the body that most people don't realize. And so stress can be more than just the guy cut me off on the highway. The emotional stress. So you have to take into account those kind of things. And I also look for those. I also do some specialized labs to really look into that. But I start at the foundation, because you have to start at the foundation.
For sure.
Yeah, you have to begin there.
Well, and one thing that you had mentioned is when people say, "Oh, but my labs are good," they immediately think like, "Okay, well, that's off the list," right? You stop going down that hole. But if the tests weren't appropriate, you may be not missing something, but you didn't dig deep enough, not as the patient, but as the doctor. And then the other thing that you had mentioned was, if you can get, their symptoms are kind of coming up in their 30s, but they're not totally visible yet on labs, assuming the correct labs are being ran. What I've observed is people in your position and my position as a medical provider, we have a lot more weight in the opinion that we give or in the recommendations we give, right? If your spouse is saying like, "Hey, you're getting a little fat, we should do something about this." First of all, a little offensive, but at the same time, at least they're honest with you, right? But we don't truly take it serious. But when the doctor turns the labs around and says, "Here's your numbers, and that's correlated with your 20 pounds of extra weight that you're carrying, you should do something about this," that's where you can get big lifestyle change, because you're showing them proof that like the body is not doing as well as we want it to. And if you want to play with your kids or grandkids as long as you want, we should do something about this. And I think oftentimes when you said, doctors generally only get 7 minutes with their patients, the patient's still telling them what's going on when they're cutting them off and saying, "I've got to get out of the room because I got to go to my next patient." And so I think stuff like this is so impactful, because you can actually create lifestyle change for people, because you have the time to listen, you have the time to talk about it, and you have the labs to back up why they feel the way they feel. And I think this is why this place is continuing to grow along with this entire body of medicine, because I think you're practicing the way everybody wants to be, like people want to go to a doctor like this. I think this is what medicine was supposed to be. And for some reason it got, all pushed in the way that it went. And so I like all of these approaches. And so I would like to move into these 4 pillars and kind of break down where you go with this when you notice people come in. We've talked about it a little bit, but so again, reminder of the 4 pillars is nutrition. I actually have down movement, so I think I mistyped, but we care about exercise, so we'll go into it. So I guess we get a bonus one, but the 4 that we generally talk about is nutrition, hydration, stress, and then sleep. But then exercise and movement matters a lot. So any of those that you want to passionately talk about right out the gate between nutrition, hydration, stress management, and sleep?
Everybody comes to me and says, "Okay, doc, what's the program? What's the hormones? What's the peptides? What's the nutrition? What's the exercise?" I say there's no program. It's all individualized. So really, it depends on the patient. One patient, it could be very simple. "Hey, you have a low vitamin D. We just need to clean up your diet, and you're going to do great." The other patient, "I got to clean up their gut. I got to work on their hormones. I got to work on their sleep and stress." So there's different approaches to every individual patient, and that's what I like about this program that I use, this AI, because it really helps you to focus on that patient as a person. And you do have to spend the time with the patient. And part of my job, like you said, is to educate patients why we're doing this and what to expect. And then when that happens and you can show them in the lab, like you said, there's a light bulb that goes off. You can see it in the patients. All of a sudden, now they get it. Now they know, I can see this will have an impact on my health. And if I want to be healthy, these are the changes I have to make. And so and I help them to do that. A lot of things I do is a large portion of my practice is hormone optimization. And hormones are so important to have that vitality, that motivation, that energy to do things, and to give people that that type of motivation to get healthy, and also to educate them on what it takes to be healthy, then you can see real results. And it's results driven. What I really like about this kind of medicine is that you do see results, and people come back and say, "Gosh, I feel so much better." I had a patient come in the other day, and she said, "I was working with one of my coworkers, and she was in her 40s, and she said, I feel like I'm 25 again." When you can get people to feel better, then they get motivated. They don't get frustrated. We see a lot of this. People, to give an example, people are overweight, have diabetes. We get on this diet, but they get frustrated with the diet because they don't see results. And they get off the diet and they kind of give up. Well, when you give people the spark of the motivation and they actually start seeing results, then you see changes in their health. And then you can also start seeing changes in their biomarkers in their labs. And then you can show them, this is where you were, this is where you are now. And that's where that light bulb kind of goes off in their head that, hey, this does work. This does help me, and I do feel better.
And I think that really gives them hope, right?
Yes,
because
absolutely.
Because when I hear stories like yours and like we have ours where I've seen this many providers, like I don't even know if I would have went to that many, right? Like I had one patient, I was her 19th person, and it's like, good Lord, you just kept searching, like power to you, But then you say, look, we're going to do this, and then you're going to get these results, and then you quote predict the future for them, and it takes place. Then they start to feel better and stuff. And then people notice, especially like the loved ones around them that know they've been going through something hard trying to get those answers. And I know we've had people, they come in, they get results, and then they start referring their friends and family. Like I know you mentioned one where like you treated somebody and worked with them and they ended up giving you like 5 more patients because they probably bared witness to some sort of either weight loss or energy boost or like just overall change in like, we'll say mental health is a generic, but probably just a happier person because now they have control over these things. They're like, wow, I can actually make an impact on how I feel. And I thought, most people are like hopeless at that point in time, and now they can actually put control over it. What is so important with sleep in specific? Because I know it's the most important thing. People say it's the most like quote slept on supplement, but why is it so important? What do you know about that?
You have to prioritize sleep because that's where you have the repair and rejuvenation. That's where your body relaxes and can actually repair itself. And also it helps to flush out. There was something discovered about 7 years ago now called the lymphatic system in the brain. We used to think the brain didn't have any kind of lymphatic system. Now we discovered that, and it occurs at night where the brain kind of flushes out all these toxins. And it's really important to get that sleep so you can do that to have clarity and focus and attention. And then it's also important to get good sleep because and you probably notice this. I would think everybody's noticed this. When you don't sleep well, the next day you just don't feel good. It's really important if you want to perform at your best. Sleep is really important because that's where you repair and rejuvenate. And that's where you can wake up with vitality and energy. And so I always ask people, how are you sleeping? Because it's important in their overall health, and you really have to prioritize it. And we used to think that, there was this mentality that we had to go, and sleep was just something in a way.
Yeah, we could sleep when we're dead.
Yeah, it got in the way. We didn't have enough time to work. We didn't have enough time to be productive, and so it was something in a way. Now we know how important it is. So I really try to tell people to have good sleep hygiene. Get in a dark room. Prepare for sleep hours before. And prioritize it in your health regimen.
Yeah, for sure. So let's get into some of these, like what I would call hot topics, because I think because it's not talked about or like heavily researched well, it probably is researched, but my point being is it's not common yet, right? And so a lot of people have different thoughts and feelings, and it sounds new, so I'm unsure about it, but you promise good results. The 4 things I'm looking at is peptides, ozone therapy, the PEMF, and then do you know much or do you use anything around like the molecular hydrogen?
Mm-hmm.
Is that some of your practice as well?
Yes.
Okay. So let's start with the peptides because in my world of physical therapy and trying to get rid of pain and things like that, peptides seem to be one of the higher talked about things. Generally, it's BPC 157, and then is there like a T100?
Yeah.
Okay, so let's start with there. What are peptides? Like, where do they come from? How do they help? Are there concerns around them?
Well, what's really interesting about peptides, I'll give you, I'm going to kind of tell you the history of how I got exposed to peptides.
Please.
When I was going through A4M, I was going through class. I could either do it online or I could do it go to class. I did both, but I kind of like going to class every once in a while because it's Scottsdale, Arizona in January and Orlando and Florida in February. So I'd be at these classes and I keep seeing the same people over and over again. And I got to know this physician, this doc, and he was the head orthopedic surgeon at the Olympic Training Center in Ohio. He was also the president of the International Peptide Society. And his clinic wasn't a building, it was acres. I mean, track and field, swimming pools, tennis courts, equestrian. I mean, he took care of athletes all over the world. And because he knew what the rest of the world was doing, he was exposed to peptides. Now, most 95% of us physicians had never heard about peptides. So when he introduced it to A4M, his lectures were standing room only, workshops sold out. So they decided to create a class, a certification class to teach the science behind peptides, what they did, what they were. And so I was part of that inaugural class. Peptides became so popular about 5 to 7 years ago until the FDA stepped in and started changing the world. But peptides are basically small proteins. If you look at what a protein is, it's a string of amino acids, and peptides typically are 50 amino acids or less. And then they're in a three-dimensional shape that acts like a key interlock. So they're kind of like a hormone, a signaling molecule.
Okay.
They turn things on and off in the body. And we've known about peptides for a long time. I mean, for probably 50 or 60 years, but we couldn't isolate them and we couldn't actually produce them, couldn't make them. The first peptide that became on market was insulin.
Oh, wow. Okay. I didn't know insulin was a peptide.
Yeah, that was insulin. And so I've been using peptides for a long time. So there's different peptides out there. There's peptides for the brain, peptides for the heart, bone, metabolism, longevity, peptides for fat loss, Ozempic, Monjaro. Those are actually peptides.
Interesting.
And so peptides, when we first got started, first learned about these peptides, we thought it was going to change medicine because they had such dramatic impact on people's health. Like BPC 157 is great for healing and rejuvenation and repair. So I think there's a place for peptides, and I think they're going to be big in medicine for years to come. But the unfortunate thing is you can't patent a peptide. And so in the United States, we don't hear a whole lot about peptides, but it really became kind of a real popular thing just recently.
Mm-hmm.
And I hear more and more health professionals and health promoters talking about peptides, and they can have a big impact on your life if you use them correctly. And there's a few peptides that you can still legitimately get.
Mm-hmm.
And really, I think the pharmaceutical world is going to take it up. And so we're going to see more peptides being introduced into the market in the future. But right now, there's some basic peptides that you can really use. But peptides are a fascinating way to improve people's health because they can be very specific. They can be very targeted. And also you can have peptides that have broad range on BPC 157. It's just an overall peptide.
So can we still get BPC 157?
You can get it orally.
Okay. But the injections are gone or what?
I'm sorry?
The injections are unavailable?
Through the FDA, you can't do injectional peptides, pharmaceutical.
Why would they take it off?
That's an interesting question.
Yeah.
Why did they take it off? Well, it goes back to when we first got started with peptides. There was a pharmacy that was kind of leading the way. They probably had 60 peptides on their formulary.
Okay.
Brain peptides, bone, metabolism. I mean, these were great. And us in the peptide societies and us that was using peptides, physicians using peptides, we thought, man, this is awesome. We have all these peptides available to us. And then they were called pharmacy. They were a 503, what's called a 503B pharmacy. Compounding pharmacies are different than like Walmart or Costco, in which they're all brand name or generic. A compounding pharmacy can actually compound the raw ingredients into a specific combination or dosage for that patient.
Yeah.
Okay. So a 503A compounding pharmacy is one that can do it individually. So I can call here in Wichita, like Custom RX, and they can compound a medication for you. A 503B compounding pharmacy is one that's invested in the facilities, the education, the quality, the staff to do it on a massive scale, almost like a pharmaceutical company.
Yeah.
And so as a 503B pharmacy, the FDA has to know your product from source to shelf.
Gotcha.
And so when years ago, when this pharmacy was doing all these peptides, the FDA came and said, hey, we don't know where you're getting your BPC 157. We thought they were probably getting it from some place in Europe, probably a reputable place in Europe. But because the FDA doesn't have jurisdiction in Europe, they can't go over and check it. So they said, you need to stop. And they really decided we're getting out of the peptide scene. And so the FDA said, okay, if you can't show us where you can get them, you need to stop. And so they stopped completely in the peptides. But fortunately for us, people that use peptides, there are a couple other 503B compounding pharmacies around in the United States that said, hey, we'll still do this. We're good with the FDA.
Mm-hmm.
And so for a few years, you could still get an injectable, which is great. You could give it IV, you can give it locally. So the way Dr. C's orthopedic surgeon would use it is if he'd do knee surgery, he'd inject it locally in the knee because it goes to a place that is really needed. But 2 years ago, September 30th, the FDA said, hey, you can't use injectable BPC 157 because you don't have any safety monograms on them, which meant that, and we know BPC is safe. We've been using 15 years. You can drown in the stuff and be safe. We know, all the safety tests have been done in Europe, but they haven't been done over here. So they said, hey, we don't have any safety monograms on it. You have to stop. And so that's when the injectables kind of went away. And I'm not a conspiracy theorist, but I'm going to tell you, there were some people who thought that, hey, why now? Why BPC 157? That ruling came out about the time that these weight loss drugs were becoming very popular, these peptides, Ozempic, Mounjaro, all these peptides were becoming very popular. The thought was there was a big pharmacy looking at BPC 157, and they went to the FDA and said, hey, we'll do the safety thing. We'll do the safety monograms for you. We'll spend $10 million, whatever it takes to do safety, but you got to give us a patent to it. And that was kind of the conspiracy theory. Well, sure enough, I heard a couple of months later after that, they were in stage 3 trials with a pharmaceutical company.
So do you feel like it's en route then? It just had to get taken up by a company?
It's really interesting. I thought the injectable would come out early this year, but we still don't see it. And I think it's because you can use it so broadly in so many different things. How do you market it?
Yeah.
Do you market it as a longevity drug? Do you market it as a repair drug? I mean, how do you market it as a drug? So we still haven't seen an injectable.
Yeah. I also find it funny that you said they don't have all the safety things in order, which I'm glad, right? We want to make sure it's safe, but you claim it is, and I understand why. But it's there's also no safety, things on 10 medications, but here we are, giving patients a laundry list of medications to take. So sometimes it feels like they sort of pick and choose. We've got a little bit of time left, and I want to make sure I give you some time to chat about what sounds like very good in your practice. It's ozone therapy, the PEMF, because I've got patients asking me about it, and I know it's, I think, FDA cleared and things like that, but to me, it's not worth much because of what I know about it. You speak highly of it, so I'm really kind of curious because you have experience, and I'm not just looking at, a website who's trying to sell me it. What is your experience? If you're okay with it, let's start with PEMF, and then we'll chat a little bit about the ozone and molecular stuff, and we'll wrap up.
PEMF stands for pulse electromagnetic frequency, and it's actually a magnetic frequency, electromagnetic frequency that you give the body, and it has different. It works at the cellular level. I kind of practice cellular medicine, and it works at the cellular level. And what it does is increase energy to the cell, increases what's called ATP, or those packets of energy that the cell uses. It increases energy to the cell, so the cell can do what it needs to do. Okay. There's a lot of things, a lot of diseases, a lot of symptoms. It's just lack of energy. The body isn't producing enough energy to be healthy. And so what PEMF does is increase the energy in the cell so it can detoxify, or it can produce more energy packets that become more energetic and become healthier. So PEMF, I use it particularly with ozone. I use what's called a beamer mat, and beamer mat is a kind of a low frequency PEMF, but what it does is increase your microcirculation. So you have all these tiny little capillaries that go to all your tissues, and typically those are very small and a lot of people very restricted. So they're not getting the nutrients and the oxygen optimally to these tissues. If you go to the website, Beamer website, and that's spelled BEMER, if you go to the website, they'll have video that shows you after 4 minutes of being on this mat, your microcirculation, it just increased tenfold.
Interesting.
And so when I give ozone therapy, I want that ozone to go to every tissue, every organ, every cell, every molecule. And so I use that with my ozone to increase that microcirculation. So it is distributed throughout the body to every cell.
What is that ozone therapy that you're talking about?
So ozone is basically oxygen plus an extra oxygen molecule.
So like O3? Okay, cool.
And it's that extra oxygen molecule that makes it so important. So when you give it into the body, it actually decreases inflammation. It turns on your antioxidants. It helps with oxygenating, giving more oxygen to every tissue. It can actually turn on stem cells.
Interesting.
So it has a lot of benefits. It's also bactericidal. It kills viruses, fungus, molds. So it has that ability in the body. So it's one of these, and ozone's been used for 80 years in Germany. They have hospitals that use ozone therapy. I mean, ozone's been around for a long time. In fact, when I was working in an emergency room during COVID, if there was a COVID patient in the room, after they left, they would take a tall tower, a light tower, and put it in the room, turn it on, and it would produce ozone to kill the COVID virus. And so ozone therapy is one of those foundational therapies that help patients just achieve health at a cellular level. It increases oxygen, does all those other things.
So would these people be coming in very, very unhealthy and use it? Or are you talking about people who are coming in like baseline healthy, or you've got them to a point and then you would use it? Like, where's this applied?
You can use it in all those situations.
Okay.
It's an adjunct. I learned from a couple of the pioneers in ozone therapy, and you can use it as an adjunct therapy to cancer. It reduces the side effects of some of the chemotherapy drugs. It also oxygenates the blood, which can be anti-cancer. You can use it in a lot of different other disease processes because it works at the cellular level. And when you improve the function of the cell, you can improve health.
For sure. Let's finish out with talking about this molecular hydrogen. Is this the same stuff that the dude Gary Brecka talks about?
Yes.
Okay. Give me the lowdown on that.
It's become real popular.
Oh, yeah.
I was at this last A4M meeting in December. It was one of the hot topics, and it became very popular. And molecular hydrogen, basically H2, it is the smallest molecule in the universe. So what we use it for is it can penetrate the cell so easily because it's so small. But that H2 molecule is what makes it effective. So it is, again, one of these cellular medicines that works at the cell to increase energy. To decrease inflammation, to increase the body's normal antioxidants. Well, it used to, the prevailing thought 20, 30 years ago, maybe as recent as 15 years ago, is we need a lot of antioxidants. So we take a lot of vitamin C and all these other antioxidants.
I mean, it's on all these like food labels even. They're like, look, there's a lot of antioxidants in here.
Yes, you take that, and actually that can be a detriment, because when you take all these antioxidants, you're kind of downplaying, you're kind of down-regulating your body's own antioxidant ability. And you really want that, because that's what occurs at the cellular level. And so molecular hydrogen actually will help to increase the body's own antioxidant ability. But it's also anti-inflammatory, also increases energy. Hydrogen is used in what's called the electron transport chain, to increase ATP production. So it really helps at the cellular level to increase energy. And to do all that, if you work at cellular medicine, you can see profound changes, because that's where it all begins.
So what is like molecular hydrogen? Because the only thing I'm thinking of right now is, again, Gary Brecka is the visual I got. And he has this little thing where I don't know where he gets the water, if it's just regular water, put it in, he'll do some stuff to it. And he's like, look, it's molecular hydrogen. But like how do you go, like you say, you think a patient needs it. Like, how do we take this? How do we drink this? What is it?
There's a couple of ways you can do it. I mean, their bottles are really, you can buy these molecular hydrogen bottles that use electrolysis.
Okay.
You push a button and you have electrolysis, and it produces hydrogen. It separates, H2O is water.
Mm-hmm.
So it separates the hydrogen from the water and creates molecular hydrogen. That's one way to do it. The other way is you can have tablets. You can put tablets in the water and make molecular hydrogen. Quicksilver is a good one for that.
Okay.
But I have a piece of equipment, and you actually inhale molecular hydrogen through a nasal cannula. And if you look at the molecular hydrogen that's produced in these bottles or in the tablets, it's like drinking 24 liters of the water, of the molecular hydrogen water, after 30 minutes on this nasal cannula. So the results are more profound. It's just like molecular hydrogen on steroids.
Yeah.
So I use it as adjunct therapy. And we, here at BeautyDot, we focus on aesthetics. We do microneedling and Botox and fillers and things like that. You can actually have it hooked up to the nasal cannula while you're having that done. And so you can get better results, less inflammation, better healing, quicker healing times. So it's kind of a fascinating new aspect of medicine. When you go down that rabbit hole and you start looking at these different modalities, different therapies, it's pretty amazing what's out there. And it's all science-based. It's all evidence-based. And there's a lot of science behind it. And molecular hydrogen is actually, a lot of science comes out of Japan and Korea, because they've been using it for a lot of years.
For sure. So to kind of close out today, Dr. Hellman, if someone is super inspired and they want to access someone like yourself here in Wichita, where do they go? Do they need to just stop into the place here? Do they need to go to a website? How can they access you? And then I can throw those in the show notes.
I work at BeautyDot.
Okay.
So you can go to BeautyDot, beauty.medspa.com.
Okay.
Or you can just call us, look us up, and you can call us, go to the website and look us up and call us and make an appointment. It's pretty simple to get in.
Sound good.
Yeah.
And if someone is wanting, let's say they're in, I don't know, Salt Lake City, Utah, and they're wanting to find a doctor similar to you, what should they be typing into their search bar to get to a provider like yourself?
So beauty.medspa is one way to do it. It's interesting you say that. I work with a nutritionist and health coach, and she has, I think now, 100 people that follow her, 100,000 people that follow her, and I'll have patients from Hawaii.
Will they come here or just do like telehealth?
No, we do a Zoom.
Okay.
We do a Zoom. We can do it over the internet.
Sweet.
So, I have patients all over the United States, Texas, Florida, south of North Carolina. So, if they want to access us, go to the website, call us up. We'll set you up. I use an international lab. I use Quest Diagnostics, which is an international lab, to get blood work.
Mm-hmm.
So if they want to find out their foundational health, that's a good way to do it. Just start there.
Okay, that sounds good. So, guys, if you're ready to stop settling ultimately for not being sick and start aiming for optimal health, this conversation was your invitation. Dr. Hellman's approach reminds us that the goal is not to just live longer, but to live better. Sometimes we say increase your health span, not just your lifespan, because we want to be healthy the whole time. And if there's something in today's episode resonated with you or it reminded you of someone that needs to hear it, please share this with a friend or a family member who needs to hear it as well. My goal was to bring on someone who could talk about some of these newer things that are out there, new to us, I guess I should say, because you say it's been around for decades, and that doesn't surprise me at all. And then if you're curious about hormone optimization, increased vitality, energy, peptides, or any of the tools that we discussed, please don't wait and just start asking better questions of your providers and seek providers who can go deeper, like Dr. Hellman. Please subscribe to today's show so you don't miss any upcoming episodes on healing, performance, cutting-edge wellness, etc. As always, let's keep helping people heal without harm. Keep asking questions, and thank you, Dr. Hellman, for coming on.
Thank you, Clayton. Appreciate it.